understood from all of you all is you are all just talking about the fact that it gets weak. But there are two different entities here. They are two completely different entities. One is critical illness, neuropathy, polyneuropathy that is, and there is critical illness, myopathy. They are two different entities. Both have supposedly have different causes. What you have done is you have just put all of them under an umbrella term, which is weakness, by the looks of the way you are talking. All of you, isn't it? Huh? So you must understand what this thing is all about. Okay. So if I were to ask Ashok, if I say what is chronic critical illness? What is chronic critical illness? Is there any definition for chronic critical illness, or what is the thinking when you have chronic critical illness?
Prolonged ICU stay, prolonged.
Anybody else? He says prolonged ICU stay. Anybody else? Ashok, you should take the effort to come and talk.
Yes.
You should not have allowed Alia to come in.
Yes.
Then?
The duration of illness, like taking more than 6 weeks to come out of it. 6 months.
Chronic critical illness was a term that was coined in 1985. Okay, 1985. Chronic critical illness was a term that was coined in 1985. For the definition of chronic critical illness, you needed to have a patient to be ventilated for 21 days. Okay, or more. To define. So this was termed as chronic critical illness. When I hear you all speak, it sounds like that. When I hear you all speak, it's not weakness, not 21. No, it's not like that. So, whereas this chronic, when I say critical illness, neuropathy, myopathy, or critical illness, polyneuromyopathy, or CIPNM, a combination of chronic critical illness, polyneuromyopathy. You can either have neuropathy, you can have myopathy, or you can have polyneuromyopathy. Okay, all three manifestations can occur in one single patient. Is an entity that may develop in 3 days also. You find the difference. So chronic critical illness is 21 days of mechanical ventilation. Whereas when I say CIPM or CIPNM or CIM, okay, this can develop in a period of 3 days. So it is known that as short as 1 day of ventilation can reduce the thickness of the diaphragm by 6%. Okay, the contractile ability of the diaphragm can go down by 6%. This is known. This is known that the contractile ability of the diaphragm and the thickening of the diaphragm can reduce by 6%. How do you breathe? You breathe from the diaphragm. So when I am hearing you all, I am hearing only neuropathy, myopathy, weakness. So diaphragm is a very important part of the entire story. When you're talking of weaning, diaphragm becomes a very, very important part of the story. When you're thinking of critical illness, diaphragm becomes very, very important because you're breathing from there. So what we know is that 6% muscle thickness comes down. Muscle thickening. This means to say the contractility of the diaphragm is going down majorly. So one of the reasons, one of the after effects, see what has happened is critical illness, polyneuropathy, myopathy, these particular disorders have come because we have progressed in medicine. We have progressed quite well in medicine. That's why we are having those patients remaining for a longer time and developing more critically ill situations. So there was a beautiful article in the NEJM in that year when they termed the term chronic critically ill to die or to keep him alive. I think that was the topic. Okay, because at the end of the day, if you cannot do your functional activities, then there is no meaning to life is one part of the story. You know, some people may say that's fine, but some people will not like it. So 50% of the people will say, I don't want that kind of a life. So all those patients who have sepsis and septic shock, okay, almost 20-25% of them only go back, only 20-25% become to functional activity within say a month or so. Okay, many of them remain critically ill for quite some time. More so with patients of ARDS. So when you have ARDS patients, almost 50% of them don't achieve functional activity at 6 months, and 25% of them die at 1 year. So your patients of ARDS, when they come off, okay, 25%, 1 out of 4 dies. 50% don't achieve functional activity. They don't go back to their usual activity. Only 10 to 12% are actually known to go back to their earlier functional status. So when we, as we progress in medicine, we learned how to ventilate patients in ARDS. We found patients remaining alive for longer period of time, but they remained alive with a very poor functional outcome. This was the entire thinking, and that's why this entire thing came into what is this thing? Why is this occurring? Why is this occurring? You got the point. That's why these terminologies came called as chronic critical illness, neuropathy, myopathy, and chronic illness, neuropathy, a separate, myopathy separate, and PNM separate. PNM, that is polyneuromyopathy. So as I told you, the myopathy or diaphragmatic weakness can start at 3 days. Usually on an average, once the person goes up to 7 days of mechanical ventilation, these patients have a very, very high chance of critical illness, neuropathy, myopathy. And why is that important? Because once you have established this diagnosis, okay, it's kind of, I would think this as a quality of intensive care. Most probably, we have not done a few things, which could probably have prevented this because there is no treatment for this. Okay, unfortunately, this particular disease has no treatment. There is no treatment for this. The only thing we can do is prevent and try to prevent. Okay, before we come to treatment, how do you diagnose these cases? How do you diagnose these cases? So it's likelihood that you ventilated the patient on day 1, day 3, you find the patient to be completely down, just standing, just sleeping, just like that only. Okay. So what would be the difference between both of them? Between critical illness neuropathy and critical illness myopathy, both are two different things. In neuropathy, you have these patients may still recover. Myopathy, these patients take a longer time to recover. Okay, there are difference between the prognosis of both those things. When you have neuropathy, you have patients that may recover. Okay, but when you have myopathy, these patients take a very, very long time to recover. Okay, now why is myopathy so important? Why is this all important? Because myopathy is responsible for functional activity, isn't it? And when the muscles are responsible for functional activity, we know from even our studies that the rectus femoris and vastus intermedius actually drops by more than 10 to 20% per day. So that we talked about diaphragm, or talking about muscle, almost 10 to 20% drop of rectus muscle and vastus intermedius happens when